And there's a new medical device that uses brain waves to more accurately diagnose kids with ADHD. We're talking to the only doctor in Memphis who's using this new technology. That's next on Local 24 Midday.
This is Local 24 News Midday.
Welcome back this midday. There's a new kind of medical device that uses brain waves to help doctors diagnose children with ADHD more accurately. There's only one physician in Memphis currently using the new system, and he's here with us today. Welcome, Dr. Arif Mirza. Thank you so much for being with us.
Thank you so much for having me.
So we were just talking a little bit about what this new test is. So can you describe it to people at home? It's completely brand new, a new way of doing this.
Yes, we are very excited to offer this test in Memphis and in this entire Mid-South region. This is a brand new type of medical device approved by Food and Drug Administration. It's also approved in Canada and Europe that measures the brain function, and it detects abnormalities in the brain function to more accurately diagnose ADHD.
And what had we been using prior to this?
The traditional ADHD testing, we had to rely on working with a psychologist or a pediatric psychiatrist, and a lot of pediatricians would give questionnaires to teachers and parents, and they would report observed behavior of a child, and then they would score those to arrive at a diagnosis. Along with that, a hearing and vision test is performed, and to look for any other medical cause that could present the child looking severely hyperactive or disruptive or unable to pay attention.
And a lot of times people have concerns about overdiagnosis. And you're saying that this new form with measuring the brain waves kind of eliminates a lot of that.
Exactly, and this is what we are excited that it's a biomarker, just like biomarkers that are used in breast cancer diagnoses or a lot of other brain disorders. This is a biomarker that actually can be used to assist to arrive at a more reliable ADHD diagnosis. Parents and doctors are equally concerned about overdiagnosis and overuse of ADHD medications, and this brainwave device, if used with traditional ADHD testing, can reduce the overdiagnosis from somewhere between 30 to 40% to only 3%.
Wow, that's amazing. How long has this been tested? It's now approved by the FDA. How long was the testing process for it?
Okay, so basically it is very convenient process. There are no needles involved. It's very child-friendly process. The FDA has approved this test from age 6 until age 17. Even one day before your 18th birthday, you can get this test.
Okay.
And the child first is seen by a pediatric psychiatrist or any mental health professional, and they can do a traditional assessment. Then we enter our original clinical impression into the system, and then a child has to wear a cap for 10 to 15 minutes that then downloads all the brainwave data, and then those brainwave data is analyzed and looked against a doctor's clinical impression, and it produces a report within 24 hours that we can then use to communicate to the family of how accurate the diagnosis of ADHD looks like, or there is something else that may be mimicking ADHD, and they should look for other causes of hyperactivity.
And real quick, if parents are concerned that their child may have ADHD, what are some of the signs they should be looking for before they can consult a psychologist or come to you?
ADHD is a neurobehavioral disorder that now, because of more high-resolution brain imaging, we are able to look at subtle changes in the brain that are evident as the brain starts growing, as the child starts having their preschool and elementary school years. Most of the diagnoses become evident at that time. The symptoms, most of the symptoms are severe hyperactivity, disruptive behaviors, aggression, poor impulse control, and lack of focus and attention. However, those are also normally occur also in normal children. But in those child with a neurobehavioral disorder of ADHD, those symptoms will be so severe that they will be almost disabling, that they will not be able to function in school. Children aggressively fighting or getting into discipline problems in school and home, where the parents should seriously consider looking to pursue more workup for an accurate diagnosis of ADHD.
Okay, doctor, thank you so much for being with us today. We really appreciate it, and hopefully you'll get lots of people to try this new format. And you can look up more information about it at nebahealth.com. The information's on your screen there. Thank you so much.
Thank you very much.
We will be back in a moment.
Thank you so much.